As you know, before we had a COVID and pandemic crisis, we had an opioid epidemic crisis, and that still goes on. That hasn't changed, and in some ways, COVID has made it worse. So in the early days of the opioid crisis, when people were realizing we needed to do something concerted and serious about opioid abuse and chronic pain management and all of those sorts of things, is we stood up the HEAL initiative at the NIH, the Helping to End Addiction Long-Term. And the early meetings on that were primarily biomedical in nature. Again, we have to live together with our biomedical colleagues, so rightly so that was what some of the early focus was on. But again, there's some very critical and important social and behavioral components to the opioid crisis, both from the substance abuse perspective and the management of chronic pain and all the other aspects of that. So our office and others worked fairly substantially over the course of the development of the HEAL initiative to ensure that there were behavioral and social science aspects that were being dealt with. And this is just three of them. One is on the justice community and the opioid effort. So I think we quickly realized in some of these meetings that the treatment's not happening in hospitals and substance abuse programs. It's happening a lot within the justice system. It's happening in jails and prisons and those sorts of things, where they are woefully inadequately supported and resourced to be able to do that sort of work. So this program is built around the concept of making sure that we're looking at how to deliver opioid use disorder treatments, interventions, and that sort of thing within the justice system. The other sort of context is in communities, and the Healing Communities studies are focused on the treatment of opioid abuse and the prevention of it and those sorts of things within communities, coordinating both primary care and emergency room departments and other community-based settings to do best practice for integrating prevention and treatment strategies there. And then, of course, there's behavioral research to improve medication-based treatments. This is the medication-assisted treatment approaches in opioid work and improving the efficacy of those and effectiveness of those moving forward. So that's been, again, another sort of large trans-NIH initiative for which the behavioral and social sciences have played a significant role. The last one I wanted to mention was our firearms violence prevention research. As you probably know, we've had a period of time where hardly any violence research was funded. There was obviously always some being funded at the NIH, but it really had been sort of a lull because of concerns about, especially with the CDC being in a position of not being able to fund particularly any firearms violence research. But things shifted relatively quickly with Congress in the last few years, and in both FY20 and FY21, in both of those fiscal years, we received $12.5 million each of those years from Congress to specifically address firearm violence prevention research. And so this last year, we funded a number of awards, both two-year R61 pilots, as well as just the traditional sort of R01 awards that address a range of things having to do with firearm violence prevention research. Everything from safety in elderly and children in terms of basic firearm safety and storage, all the way to the other end of the spectrum and the impact of various sort of policies on firearm violence and the integration of those policies with community-based interventions, community violence interventions to be able to do that work. So that's been I think a really nice sort of increase, and that's happened not just at the NIH, but also at the CDC, where they had a similar program and similar funding, and at the National Institute of Justice. So there's been a nice sort of trans-agency effort in the space over the last few years. I'll just mention before I move on, the House markup language, and I think this Senate markup language, but don't hold me to that. I know the House markup language includes this next year and fiscal year 22, a doubling to $25 million for firearms violence prevention research. So if that comes through, we'll be expanding this program in future years. The other aspect of this is that the White House has been particularly interested in community violence interventions and how do we support those and how do we move them forward. And there's obviously a program evaluation and research component to that as well. So I think we're on a good trajectory in the last couple of years with firearm violence research moving forward. So I just want to give you a taste of all of that. But so the question that always comes up for us is, how do I learn what areas of research NIH is interested in funding in the near future? So let me walk through some of the thinking here and the types of things you can do to kind of get a better sense of that. So first and foremost, we depend on you, the research community, to tell us where research needs to be done. People often forget that for all the calls that we have, the funding opportunity announcements that we put out, there's still about 80% of grants funded or grant applications that come to us each year that are unsolicited. So we haven't put out a funding announcement that says we want more research in this particular area. Instead, the researchers come to us and say, here's the rationale for why this is the next step in this research area that needs to be pursued. And they make the case for the research question that needs to be addressed. So I just sort of remind you that you can come in and should come in based on the research that you think is the next most appropriate thing to do in the research fields you work in, and not be overly swayed by what the NIH says it wants to get more research in. And it's always going to be preferable that you propose research that you're passionate about conducting and less about the research that you think NIH wants. And I think there's at least 3 reasons and probably more for that. One, you're the closest to that research area and you have the expertise, and you likely know what's the most critical questions that need to be answered in that research area. Most of us at the NIH are like me, who long ago, any sort of in-depth expertise I have is now old and dated. And my expertise is quite broad, but not very deep. And that's true for most program officers, not all, but most. And so you actually probably have more expertise than any of us at the NIH have in knowing whether this is a research area and a research question that should be pursued. And the other is that you'll typically end up with a weak grant application if you try to shoehorn your expertise into an NIH research area for which it's not really exactly what you are good at doing, but you think you can maybe make it work. Those will almost always don't score particularly well when they go through review. And then, of course, the most important, I think, for me is that after you get funded, you're the one that's got to do the work, right? Getting the grant money, it's only the first step. And you need to have enough passion and motivation about the conduct of the research that you're proposing to be able to get it done. For all of those reasons, I think most important to have this be from the researcher to the NIH sort of perspective about what sort of things we should fund, as opposed to NIH back to the researcher about what should be funded. There are a lot of sources for NIH funding interests. If you have a pretty good sense of the institute or center that probably is most aligned with your research interest, you can always look at their websites to get a sense of what they're doing, and you can always look at their strategic plans. Every institute and center has a strategic plan. My office has a strategic plan. The NIH writ large has a strategic plan. So all of those kind of give people some sense of overall the types of areas that we think are research areas that need to be stimulated and need to be accelerated. The most important one that people use are funding opportunity announcements, and the link here to this will give you all the things that are coming up, the new funding announcements that come out. And people have gotten a little confused about what these are, and so I'm just going to mention RFAs, PARs, and NOCs real quickly for those of you who don't know this, the acronyms as well as you might wish you had. RFAs for us are usually one-time, narrowly focused funding announcements with set-aside funding, right? So essentially what it means is we think that this is an area that needs so much of an acceleration in the research, and we're not getting the kind of research that we're seeing, that we're going to make a call for it, and we're going to set aside money in the millions of dollars for people to come in, and we'll use that money to fund the research that comes through that. One of the misunderstandings about RFAs is that people think it usually means it's easier money, right? You're more likely to get funded. That's not necessarily the case. There are some RFAs for which we don't get a lot of response, in which case we may fund as a percentage of the total number of applications we get in. We may fund a decent percentage of them. There are others in which the response is so large that our funding rate is actually lower than it is for the general research grant applications that we get in. So it doesn't necessarily mean that if you respond to an RFA, you've got a better chance of funding. But it does tell you that it's something that we clearly think needs to be have more research in and to get that done. And it does mean that there's a specific review panel that will look at those as a group and make some determination about sort of the rating and ranking of those applications as they move forward. The other thing I'll mention is one of the reasons it's not a bad idea to do an RFA application if it's in your area is because even though it's a one-time announcement and even if you don't get funded, you can always retool from that with the input that you got from the review and just put it in as a researcher initiated effort. So nothing prevents you from doing that later on down the process. We have what are essentially program announcements with a specific receipt and review process. Those have multiple submission dates and no set aside, but we usually do PARs where we believe that our current review panels or study sections don't really have the expertise to deal with that particular area. It's a relatively new emerging sort of area. And so we'd rather put together our own sort of special emphasis review panel that will address those sorts of things moving forward. And then if you've noticed that we don't do PAs any longer, just program announcements, it's because there was a lot of confusion about program announcements. So we've basically sort of just put them aside and we do what are called notices of scientific interest. So these are just broad descriptions of areas of research that the NIH would like to see more applications in. I'll do two other things here in terms of sources of NIH funding interests. One that most people aren't aware of, but if you're closely aligned to a particular institute and center, your research is closely aligned. The other thing I would just suggest to you is that you keep up with the council meetings that particular institute or center has. Because one of the things that we have to do at the NIH is that we have to make public the concepts for the things we're eventually going to create into funding announcements at a public FACA-based meeting, and that's usually the councils of the various institutes and centers. So you can sometimes get an early indication of what kind of funding announcements might come out from some of those council meetings if you listen in on them, especially on the ones where you can look at the agenda and then go, oh, this thing at 3 o'clock looks interesting. I'll make sure I tune in for that. And all those are public and you can listen to those anytime you want. And then the other is to make sure you're considering what we've already funded and recently funded in the research area. So we'll get a lot of applications that have done a really nice job of looking at the research that's published and building the case for the research that they want to do, but they really haven't paid attention to the research we've funded that isn't yet published. And all of that's available in the NIH Reporter and the websites here. So you can actually go through and look at all of the grants that have been funded in your particular area, the type of work that's been done, who's funded them, what review panels they went to, who the program offices are. So you can get a lot of detail from that just from looking at who are some of the recent people who have been funded in the area of research that you're interested in.